because I was surprised at the fact of the amount of struggle women have that men don't know about, that their family may not know about, that friends may not know about, and they kind of go through these struggles by themselves.
90% of all women, this is globally, this is not in the Bahamas, this is not in the Caribbean, this is globally. So meaning in the first 2 to 3 weeks, experience postpartum
2 to 3 weeks after giving birth.
Blues.
Wow.
So this is not depression. So I'm not saying that they are clinically depressed,
Sure.
but this is baby blues.
Sure.
That's 90% of women. Do you know that is A++?
Yeah.
But I remember in med school, there was a physician in obstetrics and gynecology that said that pregnancy is a disease. And I got so offended as a woman because I'm just like, that's mean. 30% of Caribbean women experience things like depression, right? That is very high. And the only reason why it probably isn't more than that is because the literature isn't there. In our community in the Bahamas, how many suicides have we had for the year?
A lot.
So now that it's hitting home, every family has somebody that has suffered with a mental issue. So now that it's knocking on the doorsteps hard, I think we're now going to appreciate it a little bit more, push for initiatives a little bit more, and understand that it could happen to me.
Sure.
So I need to do something before it does happen to me.
All right, welcome to the new episode of Myles High Podcast. This is Myles Jr. I'm your host, and as always, the vision of this podcast is to entertain, educate, and elevate you miles high above your fears, your doubts, and any limitations that you may think exist, always knowing that those limitations only exist in your mind. All right? So I, first of all, want to plug our upcoming Explore Africa tour. I'm excited about this tour this year. Dates are November 20th to December 1st. You can log on to our website, exploreafricatour.com, to check out all the pricing and scheduling and all of that good information. Hoping that you guys choose to join us this year. It's going to be in South Africa, in the cities of Johannesburg and Cape Town, doing 2 cities this year. We didn't do our tour last year, like I've been saying, so I'm excited to get this tour kickstarted again. Going with my family. It's kid friendly, so you can bring your family if you want to. It's going to be a great time. All right, so y'all check out the website, exploreafricatour.com, for all the information about the trip. Okay. All right, so we got a good episode today. We have a friend of the pod, no stranger to the pod. We have Dr. Davina Knowles-Robinson on the pod, trained psychiatrist,
Yes.
and a mental health advocate. The reason I'm excited for this pod, right? This particular pod, because so earlier this year, as you know, my wife and I just had our little girl 6 months ago.
Congratulations.
Appreciate it. Thank you so much. Thank you. And in your line of business, you are familiar with the struggles that mothers face or pregnant women face when either going through their pregnancy or post-pregnancy, right? And, because of Sharice's and I's story and, the testimony that she gave in an earlier pod and what she went through, and just the responses that we got, and that we're still getting, right? People continue to message us. Sharice has kind of become the pregnancy guru, is what I call her, right? Everyone hits her up for advice or recommendations and stuff. And I think it's just natural, right, man? Because women are relating to that story. So I felt like this would have been a great opportunity to have this conversation, in addition to it being Mental Health Month, right. In May.
Mm-hmm.
So that being a highlight for this month, I wanted to kind of bring it back to the pregnancy and motherhood and what.
And Mother's Day is this month.
Yeah, and Mother's Day was earlier this month. Yeah, so my wife celebrated her first Mother's Day this month. So just tying all of that together, I wanted to I wanted to really have this conversation, this type of conversation before this month finishes, just so that we can, bring light to it. Because I know it's an important topic that isn't spoken about enough, in my opinion. Because I was surprised at the fact of the amount of struggle women have that men don't know about, that their family may not know about, that friends may not know about, and they kind of go through these struggles by themselves.
And to that same point, 90% of women experience some mood disorder in pregnancy, and that is how high it is. And the thing about it is,
how do you define a mood disorder?
So a mood disorder is the fluctuation in what is normal, right? So if you're not expected to be sad all the time, you're not supposed to be happy all the time. But when you're in this constant state of sadness, your changes of energy, changes in concentration, changes in sleep, appetite, all of these different things, your ability to function, to carry out day-to-day activities. And why is that so significant in pregnancy is because now you're not just caring for yourself, you're caring for a child. Yeah. And I think as women, the reason why it isn't as discussed or acknowledged is because it's supposed to be a time that you're supposed to be happy. You have this bundle of joy and you're expected to just show up. And that's how we have been trained, that you have this task now to just be a mother. Like you don't have, like, yes, there are now books about motherhood and what that looks like, but there's no one that is actually pointing you in that direction, that it's okay to not be overly zealous about this opportunity. Like now my whole life has changed. For 9 months, my body has underwent changes. I'm now learning myself again. I am now reestablishing who I am because my body was taken over. And this is going to sound harsh, but I remember in med school, there was a physician in obstetrics and gynecology that said that pregnancy is a disease. And I got so offended as a woman because I'm just like, that's mean. But experiencing motherhood, now finishing med school, internship, going through ONG, I actually agree to a point, because it's almost, and I'm not going to call anybody's child a parasite, right? But imagine something inside you growing. You're nourishing it. It's changing your hormone levels. It's changing the way that you cope with things that your husband coming home 5 minutes late wouldn't have bothered you before. But he comes home 5 minutes late and now I'm having World War X because I need you to fill a gap that you didn't fill in that moment. So my hormones are out of whack. My body has changed. I am not the same person that I was 9 months ago. But you're expecting me to show up the same way. My sleep has now changed because now if we're talking about after the birth, I'm not sleeping the same. And now knowing as going through med school, and there are things that we do call calls, right? Where you're expected to be there for 24 to 72 plus hours, right? So you would think that you would be trained for this as a medical professional to be like, okay, I have to be up at these random hours. No.
It's different.
As a woman that has gone through childbirth, delivery, and the initial stages of rearing a child, that first few months was so difficult because it was like, can you please stop crying? And so this is going to be me being very vulnerable and transparent, because I remember for me, my son never latched, but I was exclusively breastfeeding in the first 6 months. So what that meant was I had to pump and feed like I was a cow, right? And that's how I felt, because it was like, you're supposed to sleep when the baby's sleeping. You're supposed to do all of these things, right? But if you're pumping, putting the milk into bottles, packaging the milk, putting it in the fridge, the freezer to store it, cleaning the bottles, and all of the different parts of the pump, which drove me up the wire. Show up as a mom. There was one night I literally held my son. I'm like, I don't want to do shaken baby syndrome, because that is a thing where you shake the baby and they can die. But I need you to work with me tonight, because.
So let me jump in there. It's an honest moment, right?
Transparency.
Transparency is key, right? our, it's our moment. So me, see now you, now you, now, now you disordered me. Nah, it's just something we came to a realization of. We realized, like, like you said, these early nights. My daughter latched, and my daughter only she exclusively breastfeeds.
Right.
So it's toxic when she reads. And like the early stage, I'd say like the first 2 to 3 months, the crying, the like, and obviously they crying. You don't really know what they're crying for. They could be crying for a plethora of things, right? And just trying to figure out, okay, what it is. Are you hungry? Do you need to change? Are you need to burp? Like there's so many different things, and it's like one day she and I just look at each other. It's like, but so we would never harm our child, right? Obviously we love her, but we understand those moments where people like freak out and do something, right? Like have an out of body experience. I liken it to when my parents died. There was a period before the funeral, in between, obviously them dying and us having a funeral. It was like a month, almost a month, but maybe like that third week in. I remember one day I woke up and I told myself, like, but I see why people is commit suicide, right? Like for real, like you just get a better understanding, right? Like you're in it,
right?
And like, you know what, this feeling I have, I can see why someone don't want to experience this and want to like just finish it off. So I could relate to that, right? And you like obviously you don't want to harm your kid,
no,
but you get to the point.
I got to the point, and so like for me, like he clearly. I don't know if like the God touched him, the angel touched him, but no, literally through that night, he slept. Wow. And he was just like, you know what? I feel you, mommy. I understand your struggle. Yeah. I'm asleep. But like, I understand. And so now as a clinician where my son is going to be 7, I am now to the point where I think I can appreciate. And so this is definitely something that I'm passionate about because I've been through it, and not that I try to go to a place of, well, because I've been through this, I know exactly. No, it's more of a place where I can now empathize a little bit better and understand it. And that's why I've like taken on, I don't want to say the mantle, but like it has been a part of the thing that I want to focus on throughout my specialty, because it's like, I understand the need. And a lot of women don't have that safe space. They don't have the knowledge or the understanding, and even spreading awareness.
Yo, the knowledge and like I am so shocked. Like my wife is well read, right? And she reads random stuff, finds out random information about anything and everything, right? So imagine being pregnant. She was reading, researching, like doing all this stuff, and so she was very knowledgeable, but I was shocked at how other women just aren't knowledgeable about like these different things when it comes to
it's lack of community too, though, because it's like, because we were trained that I'm supposed to be this person, and I'm not supposed to speak negatively about my experience because I'm supposed to be happy. I'm supposed to feel all the things and feel all the emotions, but they're not telling you you could feel the emotions of sadness, grief, misunderstanding, lack of empathy, lack of emotion. That is also feelings too, but that's the side that people shun you from talking about. Because now, sharing my story and sharing and being open as a clinician, I've been in several spaces with grown women who have now experienced menopause. And because they realize like that is the space that I am in, they now recognize and are able to say, you know what, I had twins, I had a child 30, 40, 50 years ago. And I know I was suffering from depression, but I couldn't talk about it because everybody around me told me I should be happy. And so that is dispelling the stigma or the idea that it's supposed to be just this jubilant occasion. And I think that is where we are gearing towards, where people have these spaces and are able to be like, hey, I'm not the mold. And more times than not, the mold is incorrect. That is probably the 10% of people that are just like so overjoyed and so like happy about this experience. But there are other emotions, and there's this whole other spectrum. Like I said, 90% of all women, this is globally. This is not in the Bahamas. This is not in the Caribbean. This is globally. So meaning in the first 2 to 3 weeks, experience post
2 to 3 weeks after giving birth.
Wow. So this is not depression. So I'm not saying that they are clinically depressed, but this is baby blues. That's 90% of women. Do you know that That is A plus plus.
Yeah. Yeah.
Because some women, I don't know if they
So hold on, before we get to post delivery, I want to talk about the psychiatric and psychological challenges women face during pregnancy,
Right.
because that was a shocker for me, and a shocker in the sense that like I saw it firsthand. I saw the struggles Sharice had, right, with.
And that's important. Having a partner that recognizes that, hey, something is amiss. And that's knowing your partner and knowing that, recognizing the signs that this person is going through something. So how do I navigate that space to be a better partner and not just sweep this under the rug and be like, well, she might snap out of it. Well, she may not. And this could go into something deeper.
Nah, for sure. And it's just like being aware of like what she says. Because like, sometimes, but I took it serious though. Because I acted on it. It wasn't like I said it like, yeah, she just joking, and I was like, all right, let me leave it alone. Because like she went through this phase. Well, oh man, it's funny. It's funny now. Yeah, it's funny now. But in the moment, it was like crazy. Like she was just like, yo, I don't feel good. Like I just be at the top of these stairs, and the first thought that's coming to my mind is to throw myself down these stairs because of like this how sick I am, right? Can't hold nothing down. Then I got this baby, my body's changing, and you know what I mean. So it's just like it was tough,
right?
So for me, for her to even say that, right? Number one, that's not something that Sharice would say.
But that in itself is strength, and I think
I think it's honesty too, right?
Yeah. Dispelling the stigma where it's like I am weak if I express that I am not well. But that is strength. That is you being able to recognize yourself and have insight to your own body and be like, I'm not in the best space. I need you right now to figure it out and guide me to a place where I can be a little bit better.
And I think that's the significance of a partner that is aware,
right,
and present, right? Because I feel like men, especially, I think men kind of ignore a lot of the signs.
Right. They ignore. Yeah. And two, they put this pressure on, like, you're supposed to be okay. Yeah. Like, why aren't you happy? Like, you have a baby growing on you. Be happy.
And I think the knowledge base for men too, right? Because all men see is women who are pregnant. They look like I wouldn't say having a good time, but they don't look like they're suffering, right? So if your wife suffers or your partner suffers, you're looking at it as, okay, well, this may be just a day, or man, you're just going through something, like shake that off, like you're going to be good, because I've seen this a million other times and I've never seen it this worse. Right. But we don't see it that worse because people don't show it or don't talk about it. And I feel like these type of conversations are important.
Very much so.
Yeah. So I want to go back to just giving some examples of the psychiatric and psychological challenges that women face during pregnancy. I feel like that's a good place for us to lay a foundation.
In mental health, we have a lot of umbrellas, because even with mood disorders, generally speaking, outside of pregnancy, there is an umbrella. For anxiety, there is an umbrella to talk about the different subtypes. So in pregnancy, in terms of mood and anxiety disorders, it's called perinatal mood and anxiety disorders, right? It's an umbrella term. And it focuses on, so perinatal is after you conceive the child up until some texts have a month, some texts have 6 months. So depending on your reference point after delivery, right? So during that whole sphere, you can have or develop mood and anxiety disorders, which include depression, anxiety, PTSD, post-traumatic stress disorder, psychosis. And so all of that can happen either in pregnancy or postnatal or after delivery.
Sure.
So the umbrella carries throughout. So if you have depression, you could have either perinatal depression or in pregnancy depression or postpartum depression, which a lot of people know and are more familiar with now, because people are more vocal on how they feel. And so that increases the risk of things like changes in sleep, appetite, energy, concentration, etc. Right? You can also have anxiety, which could be things like panic, generalized anxiety. So just worry about anything. And more times than not, after pregnancy, it involves like worry about the baby.
Yep.
Some people experience OCD, so worried about contamination of the baby, fear of the baby having some or contracting some disease, etc. Psychosis, which is a medical emergency, and it typically happens after delivery, but it can happen during. So this could be either like hallucinations, or meaning senses are off, where they hear the baby crying, see different things walking up and down in the house, have this, what we call delusions or fixed false beliefs not in keeping with reality. So a lot of times they fear that the baby is the devil, or they fear that the baby is going to harm them, or is contaminated and is doing something out of the way. And so there's this general thought that the reason that it's a medical emergency is because more times than not, they will harm the baby because they feel that this baby or this entity may be not real, may be controlled by some other thing. So in our community in the Caribbean, there have been several statistics done. And in terms of the perinatal spectrum, 30% of Caribbean women experience things like depression, right? That is very high. And the only reason why it probably isn't more than that
Because they don't talk about it.
is because the literature isn't there.
Okay.
In our community, it's 15%.
In the Bahamas?
Yes, and the Ministry of Health did a study, and they showed that 15% of women have depression post-delivery, right? I know we were specifically looking more in terms of in pregnancy, but like I said, the literature isn't there. And that's, I recently did a talk at a medical conference, and a lot of the obstetrics and gynecologists were in the room. And it's all about screening. More times than not, I can't, and me personally, I delivered in the States. But through my pregnancy, I can't tell you one time that a screener was done for mental health in the OBGYN's office. And according to their guidelines, and when I say their, this is obstetrics, so meaning the people that are responsible for the baby in pregnancy and the mother after, right? So ACOG shows that these screeners should be done every trimester in pregnancy, and right after delivery, and some guidelines say 3 months, some guidelines say 6 months. I probably can, if I went to 10 women who have delivered a baby today, probably in any community, and ask them if they've ever done a screener, probably 1 out of 10. And that's probably after they had showed signs or made some reference to something. But the recommendation is that every female should have been doing that.
What's a screener?
We got it.
That's what I was going to ask.
Well, we got it in the pediatrician.
So that's the
and so that's after even you going through the whole pregnancy.
That's the form you were filling out that day.
And honestly, I was so lackadaisical when I was filling out the form. I was like,
"Are you even answering?"
I feel like so that form had similar questions that they would ask us even when we go to our visits, though, right? That's why I was asking, like, okay, so a screener is a form?
So a screening tool is a tool that is used. So there are multiple ones, but there are very familiar ones that, like, me boring you with the titles makes no sense.
Got you.
But the purpose of the screener is to capture. So it should be done maybe in the waiting room. If you're filling out paperwork, you have time waiting anyway, right? They should give it to every patient so that they can fill out depending on their trimester, right? Like I said, every trimester it should be done, where they're giving it out and just checking to see if you score high, medium, if there's any risk, so that they can refer to a psychiatrist, because it's more than likely going to be missed, because they might not have a partner that says, hey, I recognize the signs. And even when they do, if you as now a single mother has nobody to watch their child, am I going to now say, I'm going to take my 10 minutes when I'm supposed to be resting, when the baby's resting, to go to see a clinician when I might suspect that I might be having these feelings? Or am I going to be more inclined to do it if maybe my OBGYN said, and they saw, well, you filled out the screener, you score really high, I suggest, and maybe looking to see if they have telehealth or any services that may accommodate you and the baby.
Yeah. So I mean, that's crazy because even though I think because so a lot of thoughts go into my mind,
right?
because you're talking and I'm thinking about Sharice and I's experience and just going through like, man, okay, so did this happen? Did that happen? Because there were times when we would have gone to like for a checkup and they would ask us these like random questions, right? And
Those are simple, like those could be
and that's
screens.
what I thought, right? Because it was almost offensive to the man. Like every time I got offensive because I'm like,
give me a question why you would feel offended because this is not about you. But if it were,
no, I know it isn't about me. I'm just saying though, like,
do you feel safe at home?
Yeah, like, do you feel safe at home?
That's a very good question, though.
I guess
you're coming from a place of almost like privilege, right?
Yeah, I don't have those.
You're not. And maybe the question shouldn't have been asked with you in the room.
That's what I'm saying. So that's
rule number one.
So that's why I thought it was awkward. So like, even if there were issues, if there was issues, you think Sharice could say yes?
Agreed. And so I 100% agree with that point. Where in a space where you're even suspecting domestic issues, which can then lead as a predisposing factor to these mood disorders. Why are you asking with the abuser in the room? Because more than likely, are you really going to expect? Like, are they supposed to like wink?
Yeah.
Close your eyes 2 times. Like, this is not a safe space in that instance. Like, you would then be like, okay, well, maybe hubby, can you just step out? I want to. Some men, to your point, will find that offensive. Like, no, I need to be in the room the whole time. But clinicians can be creative, and to your point, I do feel like those type of questions, if they are really not just doing a checklist, because it shouldn't just be about filling out the checklist, right? It should be intentional. If you are truly suspecting domestic violence or abuse or any type of pathology that you feel that the person's not going to be in a safe space to answer, make the space safe, because that's the whole point of them.
That's the point. Yeah, you're right. No, you're right. I want to introduce you to the Monroe Global app, the ultimate platform to empower your leadership journey and inspire your purpose-filled life. Access timeless teachings designed to help you grow in every area of your life. From leadership development to personal growth, Monroe Global has it all at your fingertips. With the Monroe Global app, you'll have exclusive access to powerful videos and messages from the legendary Dr. Myles Monroe, a digital library packed with life-changing content right at your fingertips, and a vibrant global community of visionaries, leaders, and change makers just like you. Whether you're at home, on the go, or in the office, the Monroe Global app ensures you never miss an opportunity to learn, grow, and lead. Available now on Google Play and the Apple App Store, the Monroe Global app is your gateway to unlocking your potential and impacting your world. Download the Monroe Global app today and take the first steps toward living the life you were born to lead. But I mean, I felt that they, even though I might have felt the way, I think it was needed, right? And I knew that it was necessary. It wasn't about me. It was definitely about them making sure Sharice was fine and the baby was fine and all of that. And that's because that was priority for me. It was just like, I'm fine with it. But we just used to laugh and joke about it though, with the questions and how they would ask it.
Right.
But you wanted to
back to the screening question. So now that you're saying it, it's wild. It's wild that I didn't get any additional screening during my first and second trimester because I was really wild. Like I was visibly unwell.
Right.
So it's like no one ever said,
especially in first 3 months.
Yeah, it was like, and then it's crazy because we had a phone call with the doctor's office and it was so bad that I couldn't even speak to them. Where I was
She starts crying.
Like.
Emotional.
Red flags, right?
And I was like, talk to my husband. And like, no one even said, maybe we need to
refer you.
They just was like,
expect it. Like,
yeah, so it's okay. Make sure
it's expected that you have some, more emotions.
Yeah.
I might be clinically depressed and need other interventions to help me out. Like, yes, I know the answer isn't always prescribing pills. But as a clinician, there are other modalities to help. So I think And so in my talk, I also spoke about like essentially gatekeeping, because I feel like it's a common practice in our community to be like, so my example always in this talk, even though I went to med school, I went through internship, and a part of internship was going through the different subspecialties. So of course I've done gynecology, I've delivered babies, I've done C-sections. But do you think today, as a psychiatrist, I should be going down the road to go deliver a baby? No, I have the tools, yes, but that doesn't mean that that should be my thing. Like if I see that this person has enough or ample time to get to a hospital to go to their obstetrician, I'm going to write the referral be like, this is the proper clinician for you. In the same way, an obstetrician, a pediatrician, a general medicine practitioner should not be prescribing antidepressants, antipsychotics, anxiolytics. Like, yes, you can maybe start the medication, but refer. So if you see these red flags, why are we hoarding all of the clients?
What causes that? Is that lack of information? Is that lack of community where even the physicians don't have a community?
Stigma and biased, I think, is the primary focus of
stigma in what sense?
So again, this is not just specific to mood disorders in pregnancy. This is just mental health in general. And this goes back to even insurance companies. And I will plug this in any speech that I have, where we have been so taught that the mind is separate from the body. So even in terms of insurance coverage, they don't cover mental health the same as they cover physical health. Some insurances don't cover it at all, right? And sad to say that even in the community of being a physician, the mind isn't taken as separate. Like it's one of those things. I feel like now, in terms of our generations, we have been pushing the need for, mental health specialists. And that's why I'm very happy to be in an era where it's more appreciated. But there has been a time when, and even so now, in some spaces where mental health is not appreciated. So it's like, well, I could do that. Like I could treat that because it's not a big deal. Like I'm not thinking of any issue. All they doing is prescribing some pills anyway. But it's more than that. Just as you did your subspecialty and whatever you did, it is more than just either prescribing some pills. It's about looking at the holistic approach and how I'm managing that. So maybe clinicians have some stigma against mental health. Maybe the general public has some stigma about going to see a specialist for mental health issues. They don't rate it the same. Like, okay, I'm not going to see a psychiatrist because then people might think that I'm crazy. I don't want the community to feel as though I'm not grateful for this baby. Two things could be true at the same time. I can have a mood disorder. I could have anxiety in pregnancy. I could have this psychosis in pregnancy, get prescriptions, get the talk therapy, be okay, and then be able to help my child. But then it comes and it circles back to the insurance companies too, having the buy-in and understanding that, hey, why am I not covering to make sure that the community is well? They're already paying $800 for their insurance. Why am I not covering mental health the same as I am their physical health?
Do you think that'll change? You think they will start it? Nah, I probably don't see that because of the money factor.
It's alleged that the person that is in charge of the insurance board, and this was just in a pod that I did a few days ago, alleged that the person or the president that is in charge has a special or soft heart for mental health. So I'm hoping that through these spaces and through communication and breaking the stigma and education, we get to a point where we see a change and a difference because it's needed through our statistics. And so even segueing off of just perinatal or postnatal issues. In our community in the Bahamas, how many suicides have we had for the year?
A lot.
So now that it's hitting home and it's not just the Jones on the street, it's not just the little uncle who has drunken his way to oblivion. It's now hitting the lawyers, the doctors, the accountants, the politicians. every family has somebody that has suffered with a mental issue. So now that it's knocking on the steps hard, I think we're now going to appreciate a little bit more, push for initiatives a little bit more, and understand that it could happen to me.
Sure.
So I need to do something before it does happen to me.
So that's like, I think we all know the stigma of like mental health when it comes to just the community, right? And especially in a religious based community where you say, just pray and go to church and you'll be fine, right? But why do you think there's still a stigma with mental health and motherhood? Like why isn't that talked about as much or enough? Like what's the blockage there?
It's because women are or weren't, because I'm not going to say are not, because there would have been a time that I wouldn't have been comfortable enough to share my story because I don't want to be felt less than. I'm pretty sure with Sharice, it's the same.
Sharice, were you ever hesitant to share your story? I don't think
I'm not someone who holds things in. Like I feel comfortable sharing. Like I don't care.
Yeah.
But there wasn't. If you look back, maybe 5 or 10 years, where was the spaces for these conversations to even be had? Right.
And I think that's why you got such a heavy response, right?
Yeah, because I think
it was like
it's like no one's talking
people
about
was like
it.
Finally someone saying it.
I think
and now I can say my story.
Because when I tell you the amount of stories, not just Sharice, like some of the women who would have seen Sharice's stories, like I would have run into them like out, and they just know like Sharice is my wife and what she went through, and then they would share their story with me, and I would be like, wow, like these women literally just need a platform,
that one spark,
just to get it out.
And I'm pretty sure we were saying that this didn't happen 5 years. Let's look ahead 5 years from now.
Be different.
It's going to be a different spin, because you were trying to say like not in my lifetime. You might not. I think I am hopeful that in the next maybe 5 or so years, it's going to be something different. And like I always reference COVID. Because I think that was a game changer for psychiatry. People were able to now vocalize and speak about their mental health and being okay with, oh, I have a therapist. And that people talk about this generation, but I applaud them for those spaces because they made it cool and less taboo to say, I go to a therapist, I get help. Before it was like, no, I don't even talk about that.
You crazy if you do.
So like these things make the conversation,
especially in the Black community.
Correct.
Especially in the Black community. I think there's a big stigma for us.
Right.
And I agree. I think I hope we get to the point where the same way we check our bodies for the health of our bodies, like we continue to check our minds for mental health.
I agree.
Well, I think too that the stigma lies in the fact that people think you should be grateful to be pregnant and you shouldn't have anything negative to say.
You should.
Because
you should be grateful, but you can also
grateful, but you could also
be
be
the opposite.
true.
Right.
Yeah.
Two things can be
I
true.
hate it. Like I hate it. And I think too, a lot of people only see the good pregnancies. So they are amplified.
Right.
And then when someone starts talking about their problematic pregnancy, it's like, oh, you should just be grateful. You can
get strong. Like they say, oh, you just be strong. Be like go to Jesus, pray about it, like and get through it.
Place too of not knowing their story. So like a lot of people take things in isolation, right? And they're like, oh, you should be happy now. But you don't know what I did or went through to get to this space. How many women have gone through 3, 4, 5 miscarriages before they got to this, and they don't even know that if I'm going to carry to term. And so every moment is a moment of anticipation and anxiety.
That's a big thing too, right? Because people would be like, "Oh, when are you guys gonna have kids? And, you getting old and this and that." And like people don't know, like, bro, you didn't think we trying to have kids?
Right.
Like, you didn't think like going through this process and things are happening and just ain't saying nothing. And like I think now people may be more aware. Younger people maybe more. I think the older generation still.
So I am one. I've been training my dad. I mean, I know he has his shortcomings, but I'm like, Daddy, please stop asking married couples when they're gonna have kids, because I have too many friends that are near and dear to me that have had fertility issues,
Yeah.
to know the struggle.
Yeah.
And there are people that may not want any. Can you like, and then there are people that may look it, stop saying, oh, that is a trigger. Can you like get out of their womb
Facts, for
and
sure.
like let them, if the baby comes, be happy and don't even tell them how they should feel. That's nice. So now I come from a place, if a female tells me that they're pregnant, I first ask, how do you feel about that? I'm not like, oh, congratulations.
Yeah.
No,
Yeah.
like unless I know your story and I know that you have been trying for X amount of times and whatever
You know
your
what?
story is.
That's a good point, Dre.
It is.
If
Especially-
the first thing everyone says is, "Oh, congratulations."
I might not be happy about this pregnancy.
Facts. Yeah, no, you're right. You're right.
I might be like, maybe tomorrow
Yeah.
I might throw myself down the stairs. Like, I don't know. Like, but I'm just saying, like, you don't know what space this person is in.
Yeah.
It's not even always what it is. Like, I might be pregnant with my, again, transparency, sorry, rapist's baby. Like, so I'm not happy about this moment. Things at home was not good. I was planning on divorcing him because he was abusive. I'm not happy about this. So now this is tying me down or sending me back another 10, 15 years. So at the end of the day, I'm not telling people to be a soft community. No, I'm trying to tell you to like be your brother's keeper and recognize that every individual case is different. And even if someone has had a baby before, that doesn't mean that they can't or are trying or want to have a baby now. Take it for what it is.
Yeah.
Be happy in the moment for the one that you have and keep it pushing.
And I think for me, I've recognized. I don't want to say the reason, right? But I can see how newborns can cause issues in marriages, right? My daughter is
7 months.
she's a Velcro baby, but Sharice is also a Velcro mom.
No.
You absolutely are a Velcro mom, right? And my daughter only breastfeeds. So 90% of the day, she wants to be with my wife. Right? So I remember, and even through the night. So because she only breastfeeds, like when my daughter wakes up in the night, like only my wife could feed her or soothe her or whatever. And it seems like only my wife could get her to go back to sleep. Because even when like I tried to like take her and comfort her, she just wants to go to mommy or whatnot. That becomes taxing on Sharice. I remember this one morning, early morning, Sharice was tired. Our daughter was crying, and Sharice just got frustrated, right? She got frustrated, and she was like annoyed, and what she was saying and how she was saying it was from a state of annoyance, and it caused me to get annoyed, but because I knew, like, okay, this just where we are right now, this isn't real.
Forever.
I said, you know what? Let me grab my daughter. Let me go out this room and
figure it out.
Let me give you some time to sleep. Because all you really need, you sleep deprived, and I recognize that.
Text commercial.
Can you believe? I trying to grab my daughter. She's still saying no, don't take her. I got her, and I was like, nope, give me this little girl, please. Right? And she got about 3 hours of sleep. Right?
Needed it.
I took my daughter out of the room. I was with her for those 3 hours. After that 3 hours, she was an entirely different person. In fact, she came to me and she was like, you know what?
Thank you.
Thank you for those 3 hours.
But how many women don't have that?
And absolutely. And not even don't have that. How many women have partners in the home or husbands in the home that don't take that initiative?
When I say don't have that, I don't care if you're a single mom or a married woman. There are women that are married and essentially single because the husband is absent. So like at the end of the day, you as a outsider looking in and you're saying, well, you're married, y'all have the ideal situation. It's still not perfect. It is still a struggle. And so when you were saying earlier with your initial point of, why do I have a brain fart? I can't remember. Oh, you see why some marriages don't last because of the newborn, right? It's because every situation isn't ideal. So to the point that you made that you read these books, throw those books in the garbage because there are helpful tips, but your child is not the book.
Absolutely.
Your
no
child,
blueprint.
Right. There's no.
Yeah.
So there's Some guy, you take it with a grain of salt, that may help you, but you realize when you're rearing your child, your situation is different.
Mm-hmm.
And so you have to do and tailor your program to what works best for your family.
So how do you feel about the shame in diagnosis, right? So you have women that may go through these mental blocks or mental challenges during pregnancy and post-pregnancy. Do you come across women that are embarrassed or feel shameful for the fact that, man, I'm actually depressed, or I'm going through these emotions? If you do, how do you deal with that? How do you deal with the shame of it?
That is a barrier to treatment. Besides the stigma of that is a part of stigma, but that is a barrier to treatment in that if you don't feel as though you should, or because society has told you you shouldn't, and so you're not getting the treatment. Example that I would give, if you were to go out in the street right now, get in a car crash, break your leg, are you going to be ashamed to wear a cast? No. The same way, if your blood pressure is through the roof, you're having headaches, maybe passing out, have a heart attack, are you ashamed to now lay up in ICU? No, you want the treatment, right? It is about us understanding and embracing. Again, this goes back to breaking that stigma, breaking down the barriers of treatment through education, through these podcasts, making people feel comfortable and acknowledging, just as you have a physical ailment, you can have a mental illness that is decreasing your functioning and destroying your health, and you need treatment for it. And that's okay, because two things can be true at the same time. You can have a mental illness, get treatment, and be well after. You can take care of your family, go back to work, and be on antidepressants and antipsychotics and anxiolytics and be okay. But what's worse is now you're drowning. You're thinking that your baby is an alien. You want to suffocate your baby. You want to throw yourself down the stairs. You're not performing at work. You're not functioning at home. So your life is essentially crumbling. Where do you think you're going to end up? Either in hospital, meaning Sandilands, or PMH or doctor's hospital, or whatever mental institution you're watching this from. 6 weeks, 6 months, whatever down the line, because now you didn't nip something in the bud that you could have taken maybe some pills for today. So it's the same premise. If you don't control your diabetes or your sugar today, tomorrow you're going to end up in ICU.
So we talked about like the role of therapy, the importance of it, right? You just talked about like medication and its advantages that you could have, especially when caught early. Are there any holistic approaches that can be taken, right? Because you have people who, may not want to be on the medication or the drugs like for an extended period of time, right? Because some of these antidepressants you have to take either for the rest of your life or for a super long period of time, and it could have like
so there are guidelines for those, and so the antidepressant wouldn't be lifelong unless it's indicated, right? Okay. And I get the concern because anything that you put into your body does have its own effect to you personally, and especially if you're talking about either in pregnancy where it can be passed to the baby through the placenta, or even after pregnancy when you're talking about certain medications can be passed through breastfeeding. So the clinician will take all of that into account, but then there's always just general hesitancy to not want to take medication. That's fair and fine. And that's the importance of having conversation. And through practice, and I always express, I'm not God. At the end of the day, this is your body. And I want to make sure that whatever plan that we are on, that we understand the risk and the benefits to both. And I also put the caveat that if you're mildly depressed, and so we talk about the risk to benefit ratio, right? That we might not start you on depressants or antidepressants today. But if in 3 to 4 months down the line, our talk therapy, which we're going to get into, isn't working because it's not enough, because your hormones and neurotransmitters are imbalanced, and we need to put you on some medication, I'm going to put that back on the table and let you know that it's time, and we are not, because now we're circling the drain maybe for an admission. So which spectrum do you want? So yes, I would lay out the pros and the cons for that. The next side of it is the treatment isn't just about medications. It is about talk therapy. So things like changing how you think and your thoughts, your beliefs, and trying to put those into action. So we call that cognitive behavioral therapy. There's mindfulness. There are holistic approaches like yoga. So people find that Eastern medicine is helpful. So stretching, yoga therapy, sleep hygiene is always very important. And I talk about that with any mental illness because sleep deprivation can cause a whole slew of
Sure.
other issues. Social community. So making sure that you have a community that is supportive. And even though we may not have it in the forefront, there are communities in our country and in our community that are there for women.
So why aren't those communities advertised or promoted?
They are so it depends on the circle that you're in.
Got you.
Right?
Got you.
But it's also about these platforms acknowledging them as well. And so it's about one of those not gatekeeping your story so that you could be helpful to someone else, which would then kind of lead you and guide you into that space. But it's important for us as clinicians, as doing the screening and making these recommendations too. But there are networks out there that women can join.
You know, that's funny because Sharice and I had a conversation recently about she was saying how she has continued to get stories. And like when women I don't know if I want to talk this. Anyway, so like women would find out they're pregnant and tell Sharice before they
Tell their partners.
not tell their partners, but like how they like tell family and friends and stuff. So I like I said, I call her the pregnancy guru, right? But we were having a joke about it one day, and I was saying, man, like I think it would be cool if like you do, because like so we're talking about like creating these communities and like platforms where women could feel comfortable having these conversations. And because she opened up and has gotten such a big response, I was like, man, you should think about doing something, right? Whether it's a retreat or a seminar or a conference or something that, you know, can bring women together. Because I feel like it's necessary. And I feel like the more conversations that are had, the better, the more comfortable and the more normalized this topic could be. And women going through it, like a woman who goes, like me seeing Sharice go through this for the first time was a shock. But someone who's heard our story, if they are going through this for the first time, it won't be as shocking, right? Because it's be like, okay, we heard about this.
The cap off of what it's supposed to look like. Sure. I'm pretty sure for the layperson, it's supposed to be
pretty imperfect.
Not even. Oh, yeah, pretty imperfect in terms of pregnancy,
okay,
right?
Yeah.
But what I'm talking about is mental illness or mental illness and mood disorders in pregnancy, where it's supposed to look like maybe you're being abused or you're being mistreated or you're in a situation where you were using substances like alcohol or you're a single parent. So that is what mental illness might look like or should look like. But it also can be in women that are first-time mothers, that are married, that come from a good stock, have money, and are all of these things, these societal goals. That can also happen in these spaces too. And so I applaud you, Sharice, for telling your story because it gives women the idea that Me Too. And it's like our own Me Too community because it's not just this black and white thing. It's all these spectrum of women that have or may have gone through this experience. And I'm not saying, like I said, it's 90%. So it's not, there's a 10%
That's
of women.
A lot though.
Right. So, but I'm saying this is not a one glove fit all. So I'm not saying that every woman has experienced this.
Yeah.
But 90%.
I mean, 90% of the world population of women, that's a lot.
Right.
That's a high percentage.
So I think it uncovers it takes the mask off of what it's supposed to look like and shows you that it can happen to anybody. And so I applaud you for even thinking about that space, opening up. But I do want to put a asterisk there too. Set your boundaries. Because you don't need to rip the Band-Aid off of so sometimes when someone because that might not be a day that you're open and willing because I'm going through my own stuff too. So even me as a clinician, I'm like, I hear what you're saying. I want to help you, but maybe you could book an appointment.
Mm-hmm.
And so it's not to be mean, but you have to also protect yourself.
Mm-hmm.
And I'm sure, like we spoke about the church and the community of us being a more religious society. Pastors have to put up their boundaries too. They can't take it on. And that's why you have, different pastoral roles for
Sure.
different people.
Mm-hmm.
Because at the same time, not everything you can be taken on. So not every woe you could address, because then now we're talking about PTSD,
Mm-hmm.
because now I have to reopen my old wounds to help you. And I'm not in that space to do that today.
Yeah. So, we talked about all of the mental issues or mental challenges, let's call them, that women go through, not only during pregnancy, but, post-pregnancy as well. But what are signs that, and I'm sure we've spoken about this already, but maybe just to reiterate, like signs where you know that, hey, I need to seek some help. I need to get some help. Like what should women look for, and what help should they seek? What kind of help should they seek? Like, what's the first thing that they could do?
The two biggest indicators that if you go to probably any psychiatrist would be changes in sleep and changes in appetite, right?
Mm-hmm.
I know that if we're talking post, that would be kind of hard to recognize because you're up when the baby's up.
Mm-hmm.
But if we're talking about during pregnancy, right? If you're now up all through the night or you're sleeping a lot more, yes, it could be changes in hormones, but that could be a very big indicator.
Mm-hmm.
Changes in behavior. So the person isn't doing the same things that they normally did. And it's not just because they're tired because they're dealing with this newborn, but they're misplacing stuff. They're a bit more disorganized, and that's not on brand for them. Like, why is this person's whole behavior changed? If their speech is a bit different. So like you said, you recognized when she said certain things, and yeah, I could brush that off as a joke, but when it's becoming more persistent, like, why are you saying these things? That's a bit odd.
Mm-hmm.
Check in and figure out, like, is everything okay? And then they might be able to open up and be like, no, I'm not feeling the same. If you see them always sad and crying, like Cherie said, the doctor called her and she couldn't even finish the conversation because she was crying. Is that normal behavior? No. And so being able to see that in these spaces, so in the context of, why are you frantically cleaning everything all the time?
Mm-hmm.
So the things that don't make sense for a reason.
Sure.
And so maybe read into it a little bit.
Don't
more.
ignore it.
Yeah.
Got you. Do you feel like there's more to life than what you're experiencing? That deep down, you're meant for something greater? It's time to stop wondering and start discovering. At the Monroe Institute of Leadership, we believe every person carries a unique purpose, a calling designed specifically for you. Our transformative courses, Discover Purpose and Unlock Your Potential, are crafted to help you uncover that purpose and equip you with the tools to step confidently into your destiny. These powerful courses are for leaders, entrepreneurs, students, and visionaries like you. Through proven principles and actionable insights, you will clarify your vision and set bold goals. You will identify your strengths and passions. You will overcome the barriers holding you back, and you will step boldly into your God-given potential. Our expert facilitators draw from timeless and tested principles, blending practical strategies with kingdom truths to empower you to lead a life of purpose, impact, and transformation. The world needs what you have to offer. Don't let another day pass without unlocking the greatness within you. Visit our website, themill.org, and register today. The Monroe Institute of Leadership. Renew your mind and transform a generation. Well, anything else you want to share? Any other topics we didn't cover?
Shameless plug. I was supposed to do this from the beginning. But you can find me on social media at St. Cloud.
No, we was getting to that.
Yes, but St. Cloud Medical, just shameless plug. But even when you get to it again, I could circle the block. Consistency is key.
I don't know more than what's cool, man. Cool. The reason I asked about like when to seek help, because it was because like I knew when I needed to seek help or help Sharice find something,
Right.
find some type of release, because I knew that it was important. Like you say, like when your partner starts saying things that aren't normal, or you see changes in like their moods or just who they are, like as you know them, like those are signs. But I don't think, and this I'm speaking to like the men, right? Like I feel like we need to, like we're a part of this pregnancy process, right? Going through pregnancy, the labor and delivery, and then even post pregnancy. And I think it's on us to like really try to step in. Like I know it's hard, it's difficult. One of the challenges that I have with my daughter is I could put her to sleep, I can't put her down.
Mhm.
She gets up every time I put her down. That's
Right.
frustrating because now I gotta call Sharice to be like, you gotta put her down. You know what I mean? And like I want to be able to figure out how to do that for her. I don't know if it's like the way I'm doing it. I'm not, you know what I mean? It's,
Right.
whatever it is. But
Right.
for us, like we need to find ways that we can, you know, alleviate some of these stresses,
It's
especially when it
understanding
comes to
your
newborns.
limitations,
Yeah.
right? Understanding your limitations as a man, but also acknowledging that I could do more too.
Mhm.
So at the same time, understanding your partner, understanding where their needs need to be met. Because, like I said, it isn't a one glove fit all.
Sure.
And not everybody, even if they are diagnosed with the same illness, their needs may be a bit different. So it's meeting that person where they're at and understanding what they need in
Mhm.
those moments. Like you said, you recognized in a moment that she just might have needed sleep. And that's okay. She might need to feel like a mummy. So at the end of the day, understanding she needs a social connection that's not just you and the baby.
Yeah.
So giving her the freedom to be like, yes, I know I might not mother the same way that you're going to mother, but go out with your friends, take 2-3 hours out to lunch, go get your nails done, go get your hair done. Even though she's a Velcro mom, she will understand and appreciate it when she comes back.
What you say?
I said, I'm going for my facial.
Coming right back home though. If that facial take too long, you have a problem with it.
It's okay.
I laugh when you said it because you say go out with your friends and just spend 2 or 3 hours. Sharice ain't doing that. Sharice probably give you an hour.
I said meet your partner where they're at. So you know that's not what your
But you
partner's
know,
going
to your point, everyone's different, right? And I don't want no one to think that your story is going to be like our story or like Dr. Knowles' story. Dr. Knowles-Robinson's story.
That man is talking about this last name
So
all the time. You better remember
I
it.
got you. I got you, bro. But you know, the point is for us to share our stories so that you can take parts of it and make your own. I think that's what it's about. Because like there is no blueprint. There's no step process that we take to get through life, much less pregnancy or
Right.
motherhood or whatever, right? Or parenting. But the key is to get as much information as you can get and then decipher that information and figure out, okay, this is going to work or this is what I want to try for myself and my family.
And I think to add to that gold standard that you're trying to set is getting the help that's needed.
Yeah.
So not like it's okay to identify it, but what do I do after
Sure,
identification?
sure.
Like where are my resources at? Like how do I navigate this space and get the help and seek the help and actually do the work
Mhm.
that is necessary?
So that brings me now to ask you, like, where can people seek help, right? Of a mother going through pregnancy or had just now, you know, delivering her child, but going through some emotional changes, mental challenges, some depression. A man and his wife or his partner just having a kid, he recognizes that a change in his partner. Where can they go? Where do they start? Like, who do they call? What website can they go to? Like, what's the next step?
So the first step is obviously you're being seen every trimester or every month, depending on or every week, depending on how far into pregnancy you are,
Mhm.
right? So that clinician is your OBGYN.
Mhm.
If you're feeling a type of way, advocate for yourself.
Mhm.
If your doctor isn't providing you the screeners, maybe ask to take one because you're experiencing this type of symptom.
Mhm.
And the clinician, more times than not, should know. I don't say would know, but should know a psychiatrist. So because I'm on this pod, obviously I'm going to recognize myself.
Sure.
I am at Oak Tree. I do treat patients there privately with mood disorders in pregnancy and postpartum,
Mhm.
even outside of pregnancy, right? So there are clinicians, psychiatrists that are available
Mhm.
to treat these illnesses. There is the public, there's the community counseling and assessment center in the Bahamas that also treat issues as the same. And maybe you might feel as though I don't want to just see a psychiatrist. Psychologists are all also available too. But the proper psychologist will also know when to refer to a psychiatrist because this is out of my scope of work. So it's advocating for yourself first and then also realizing that, hey, a specialist like a psychiatrist is the person to go to.
Mhm.
Me, myself, Dr. Knowles.
So yeah, man. So plug. How can people get in contact with you if they want to?
So I'm at Oak Tree, East Street South
Mhm.
location. Also, I have my own social media platform,
Mhm.
St. Cloud Medical. So you can find us there. We are always shedding tips and tools for mental health and mental wellness.
Mhm.
So that's me and my colleague, Dr. Johnson Dames.
Okay.
So the cell phone number for the East Street South number is 825-4674. That's Oak Tree East South. And the telephone number for the landline is 605-4083. But if you want to reach me via email, it's Dr. Knowles, so Dr. Knowles, at Oak Tree Medical Center. And that's CENTER, not the British Center. .com.
Yeah.
So-
Okay. Cool, man. Cool.
I have a question. Do men get any sort of depression associated with
100%. 100%.
They do. And so I'm happy that we spoke about the women, but I don't want to negate the men. And that's a very good question. Men are also going through the changes too. Even there are some men that go through the whole pregnancy changes where they gain the weight, they have the emotional changes. So I don't want to negate that experience too, because some men actually do experience all of the symptoms of pregnancy. I've heard about men having vomiting in pregnancy.
Really?
Yes.
Wow.
So don't feel just because this woman carried this baby, they're now being neglected too because now the baby is taking over the bedroom, possibly. I'm not getting any attention as a man. I may not have had sex for maybe weeks, months. So my emotional sexual urges have been neglected.
Mhm.
I don't want to cheat on my wife, which I would hope. So now it's like I'm losing myself throughout this experience. And so now my mood has changed because of this adjustment.
Yeah, I think it's and I want to say this very carefully, right? Because you have a woman that just went through 9 months of pregnancy and just went through this traumatic experience of labor and delivery.
Right.
And now you have like post delivery and you're caring for a newborn.
Right.
And there I am about to say that I think it takes women and men, especially I'm speaking to married women and men, right? A married couple.
Right.
Like it takes both of you having gone through like everything you've gone through to bring this child into the world, but still putting your marriage first.
Right.
And, you know, the man being aware
That is 6 weeks of healing anyway.
Yeah.
So you shouldn't be pressured.
but even I mean, I'm outside of like sexual needs, like just other needs, because men don't just need sex, right?
Going to my dad.
But I mean, like there are like other things that we need.
Right, fair.
In addition to sex, sex is important. I'm not saying it isn't, but
Because some men might be under the comments later and be like,
that's true. You're right.
bro, speak for yourself.
I'm not saying in any way, shape, or form that sex is important. We need that. I mean, we could need that.
Fair.
Turn the baby around. let her look at the wall.
This conversation is going somewhere.
She know what's going on anyway, not right now at least. But there are other things, right? And so I just think like, you know, it's good to still prioritize the marriage. And Sharice and I try to do it as much as we can, whether that's, you know, going out to lunch, or even like making time for ourselves here,
Intentional.
like, making dinner and eating dinner together, or
Agreed.
lunch together, or doing something together as a couple.
I think you said something important in a previous pod where you were like, the saying is happy wife, happy life,
Mhm.
right?
Mhm.
If we are in a partnership, it isn't just about one person.
Mhm.
And so, yes, this whole spiel was about pregnancy, mood disorders in women, right? But realistically, for the relationship to work post delivery of a child, there has to be focus on both partners.
Yep.
The man shouldn't feel completely neglected. And that's when, like you said, being intentional, carving out time, even though sometimes it may feel impossible. Date your husband,
Yep.
even though you've been married 5-10 years. Be intentional about times. Carve out a day a week. Maybe that might be too much. So maybe carve out a day every 2 weeks
Mhm.
where this is not about the family. This is about me and you.
Mhm.
What are we doing to disconnect from the responsibilities of the home?
Mhm.
Understanding our financial limitations. So it does not have to be always going out for dinner. Maybe we're going for a drive where it's not with the kids and the dog. It's about me and you reconnecting on a level, because where that's going to take us in the next 10 years is I'm unhappy. I'm not married.
Yep.
I want a divorce
Yep.
because we've, like I said, through the pregnancy, this woman has changed. I saw something recently in the last week where this celebrity, she was talking about hearing this speaker talk about how he was somebody that navigated different tribes. And he went into this tribal community where the practice was when the woman is delivering the baby and the water breaks and there's like this drop of blood and all these different things. The women of the community gather the cloth because it's all on this cloth. They gather the cloth and they bury it. And they have a little ceremony for the cloth. And then they come back to the room and they reintroduce themselves to the woman because she's now a new person. Right? So the reason I say date your spouse is because this person that has now bared these different children is not the same person that you met
Yeah.
10 years ago, and you should not expect them to be. We are all, something your father always said, change is the only constant.
Absolutely.
If you're not changing, you're not growing. So don't expect your partner to be the same person that you met and married. You both should be evolving and growing. So now, if you're dating each other, you're now relearning, having that conversation about who we are, where we want to be, and learning each other for this new space of life.
Yeah, and I think it's a conscious effort between both parties, right? And I know it's a daily reminder for me. Like I have to be aware and intentional about like little things. It's usually the little things that snowball into like these big issues and create the large challenges that we have in our marriages. So yes, recognizing that sometimes the trivial stuff like if my wife does something or doesn't do something, if I could do it, like I'll just do it. You know what I mean? Just to
There's no more gender roles.
Yeah.
Like why the woman is supposed to do it. No, it can be both of us doing whatever is needed to be done to get this house up and running and ticking how it needs to tick.
Yeah, you're right, man. I'm as always, I appreciate you coming on the pod. I feel like this was a great conversation. I think a much needed conversation. And a conversation that I would hope happens a lot more or starts to happen a lot more. Yeah, yeah. But I appreciate you coming on, sharing your wisdom with us. So if you're in need, if you're a mother out there, or if you're just an individual out there, a human being that needs someone to talk to, if even just to check in, right? Checking on your mental health. Ms. Knowles-Robinson, I feel. Dr. Knowles-Robinson, don't let me disrespect that. She is highly recommended. Definitely, she's our resident. I drew a blank just now. Thank you. She's our resident psychiatrist on the Myles pod. She is in a stranger here and definitely is going to be back. I promise you. It's because I love these conversations, right? I am an advocate. I'm also an advocate for mental health.
Thank you.
And I feel like we don't talk about it enough. And I feel like if we do and when we start doing it, we could maybe not solve, but we could,
change the direction.
Yeah,
in which
change the
community is going.
the direction that not just the adults go, but our kids.
Correct.
Because you mentioned suicides here in the Bahamas. Like we've had kids kill themselves in the Bahamas, not even just in the Bahamas, like globally. Right?
Mm-hmm.
And it's just like crazy to think that a child would think that they don't have any other
Alternative.
options. You know what I mean? And that's just crazy to me, especially for a kid who shouldn't be worried about anything else about except like having fun. Oh my God.
So I cringe.
That's a stigma to it.
Yes, I so cringe.
But when I say shouldn't be worried about, I don't mean like they shouldn't have adult feelings or emotions or whatnot. That's another stigma. Let me just shut up. Go ahead.
Times 2. At the end, kids are little humans and they are going through a lot, especially in today's society where there are so many different pressures that we didn't face even as children. Being, I was just a child 2 years ago, but
yeah, right.
all jokes aside, because it is a serious topic and working in both the private and public spaces, these kids are hurting and they are going through adult issues. When adults, a lot of times we speak from a place of privilege. A lot of the time, even in having these conversations where we're saying children don't have adult issues, but they do. If you as a 7-year-old is now taking care of your brother, sister, and 2 other younger siblings, because they're maybe not even your brother, sister, they may be your cousins because we're all living in Grammy's house. But the new mummies are only 20. But they've already had 5 kids. So me as Mr. 7-year-old has to make breakfast, get everybody dressed, walk everybody to school. Because I'm pretty sure in our community you have seen kids as young as 7 to 9 with 4 other little kids behind them. And you're like, why? Because I have to. So they are going through adult issues. And so now the child is in school disheveled. I've had the last pod was about this. So kids are going through stuff. And even if we take them out of those spaces, because just as we said in this pod, where it can be kids that aren't going through that dramatic exchange of emotions. Things like divorce can set children in an adult space. Things like abuse, and even if those things are negated and we say that this child is in a privileged home, why do they feel sad and depressed? There's nothing that you should feel sad and depressed for. Genetics. Having a family member that has had depression predisposes this child to depression. Bullying in school. So even though I have the lights, the camera, the action, and I have all of the things that I'm supposed to have, I don't have the love and care because now my family, they're rich. And so it doesn't look like neglect. But I'm with the nanny all the time. I just want my daddy to show up to the softball game. So to you, it doesn't appear to be and I'm not saying you specifically.
I got you.
As an adult, you have everything. You don't have a care. But for me, how I process that, how I was able to cope and respond to these certain adult situations, I didn't have the tools because I was never trained that way. And so now it is expressing in depression. And now that depression is turning into self-harm. So before I even end up thinking about suicide, I'm cutting my wrist to cope with this internal pain that I'm having. So not necessarily wanting to end my life. And this might now evolve into, well, no one is around. I'm with the nanny, but my family doesn't love me. I'm unlovable. So it's not that it's because they don't love him, but because I have the resources. Like, you have everything. Yeah. You should be okay. But I want that maternal love.
Yeah.
The nanny's not, I want mommy. So no, I don't have everything. And even outside of that, if we even take all of those environmental factors away, I just have depression. Because children have diabetes. children have hypertension, but why can we identify those things as okay and normal and not having a child with depression? Period.
Yeah.
Without the environmental stuff. This child has depression, not because of anything else. So recognizing that is important as a parent because, again, that just circles us back that mental health is important, period.
Straight across the board. Well, I think we have the topic for our next part. Kids and mental health. Look at that. Look at we segueing right into our next episode. But I'm serious. I hit you up.
That's fair.
I think that's a good point because we don't think about the traumas kids have because we don't think kids should have traumas.
Check out the YouTube video that we did on ACEs just a few days ago. It just landed on YouTube yesterday. It's there, but we could talk about it too.
We could talk about it.
Yeah, I think we could talk about it too.
Very different. But I got you. Check. You can check there as well. Oh man. No, but thank you for coming on. I really appreciate you talking about this topic and just being an advocate for mental health. I think, the more we're able to have these conversations, the better our society could be. All right.
Thanks
So
for having me.
appreciate you joining.
Thanks.
So that brings us to the portion of the part I want to leave with you a milestone. The milestone for today is directed at the fathers, the family members, and the friends of mothers and potential mothers, right? My challenge to you is to always be aware, be present, and be supportive. We don't really know all the time what our pregnant partners or even the mothers are going through mentally. But just be aware of what they may be going through, what they say, what they're doing. Be present in every situation as much as you can. And then just be supportive of them. I think the support is probably most important because they need it, right? They just may have gone through a traumatic experience with bringing life into this world, and not having any support system around them could make matters worse. So just be present, be aware, and be supportive. Okay, that's my challenge to all of us in support of our mothers and what they do for us on a daily basis. All right. So that closes out the month of May. Thank you for joining Mental Health Month as well. I think this was a good way to just to bring awareness to especially what women and mothers go through with mental health, with motherhood, and all of that. Looking forward to our next conversation.
Thank you.
Hopefully that's sooner than later, right? So as always, the vision and goal of this podcast is to entertain, educate, and elevate you miles high above your fears, your doubts, and any limitations that you may think exist. Always knowing that those limitations only exist in your mind. All right, so until next time, you guys stay blessed.